Welcome to the channel Naturopathy Cure and Healing. I am Dr. Balakant Jha, naturopathy doctor, practicing naturopathy since last 6 years. I have cured hundreds of patients of piles without the help of any medicine. So actually, this is the combined name piles. It has three others. Diseases, they are fissure, fistula, and blood-laden piles. So today the discussion of piles, introduction, symptoms, cause and treatment. We shall discuss in detail. Piles are among the most common diseases nowadays. In external piles there is a lot of pain but not much bleeding. In case of internal piles there is discharge of black blood. In some cases then bursts and results in bleeding known as piles. It is important to mention that piles are not disease but a symptom of disease. This is a disease of modern civilized society. Food prepared from fine flour, white bread, tinned food and consumed caused constipation. Chronic constipation weakens the membrane of the intestine. There are feelings of heaviness in the anus, region, and difficulty with pain in passing a stool. Impure blood collects in the vein, comes down to anus. This creates haemorrhoid and known as piles. Piles is not disease as we presumed, but a kind of symptom which has been due to outcome of wrong eating and wrong habit. If we reform the habit, we would get automatic cure from this symptom. Swollen and inflamed veins in the rectum and anus that cause discomfort and bleeding. Hemorrhoids are usually caused by straining during bowel movements, obesity or pregnancy. Discomfort is a common symptom, especially during bowel movements or when sitting. Other symptoms include itching and bleeding. A high-fibre diet can be effective along with the stool softeners. In some cases, a medical procedure to remove the hemorrhoid may be needed to provide relief. Symptom: there is pain in the passing stools and slight bleeding in case of internal trouble. Sometimes patients fear to go to toilet. The patient cannot sit comfortably due to itching and hemorrhoids. The patient has difficulty in sitting, particularly when he is to sit in indigenous toilet. The basic cause of piles is chronic constipation, which has been being neglected by the patient since a long time. Constipation and congestion caused by wrong food habits ultimately results in pile, fissure, and sometimes fistula. Long period of standing or sitting, strenuous work, obesity, and general weakness of the tissue of the body are other secondary causes of piles. Mental tension and sleeplessness are also one of cause of piles. Eating more than we digest may develop mental tension and a relative impact on your body. Taking too much medicine to cure any specific and particular disease or ailments of the body may cause constipation when you are thinking of improving health and vitality. Here the basic point is understanding about the potentiality of the body and its anatomy. When we know that body is a supersonic machine and it has power to cure any disease, we don't need any medicine. Treatment. To cure piles from the root, it is necessary to remove constipation first from the digestive system, and it is a time-consuming treatment. Chronic constipation with the piles is the subject matter of improvement of whole body. Therefore, the patient has to bear in mind that curing takes time. However, the symptoms start subsiding from the start of the treatment. The patient has to control food habit and eat only such food which produces soft stool, so that it is not cause much pain when it is expelled by bowels through anus. The patient should take salad, juicy fruits, vegetables, or their soup as main food. The buttermilk is one of the medicine which removes excessive heat from the abdominal region. Taking this food regularly for 3-4 days, the symptoms subside to a great extent and will cure if it is in beginning stage. Taking the above said precaution, if the stool is not becoming soft, the patient has to take enema from 2 to 3 times a day. Note that once a day enema for 21 days daily can drive the all symptoms away from the patient. After clearing the constipation, the patient is recommended to take enema for 50 grams coconut oil intestine to loosen the stool, which even kill the unfriendly bacteria which are causing gastroenteritis. The enema 6 days out of 21 days should be taken or given with buttermilk if there is burning sensation in the rectum or anus region. The patient should take hip bath and cold bath in the ratio of 5 to 3 minutes, which is also known as fermentation. This would have soothing effect on the waist area. Diet. The patient has to change diet little from the regular diet. They are to include wheat mass, wholemeal bread, lupa gourd, spinach, white good food, cabbage, unripe papaya, all green vegetables, ripe bell, ripe banana, muskmelon, apple, pears, buttermilk, milk, raisin, big dried grapes, bukhara plum, fig, and coconut. The patient has to avoid taking pulses and stimulating foods should be given up completely. Apart from above, the patient should take 3 grams isabgol with each meal to further loosen the stool. I hope that the patient would get cured with or within 30 days. Thank you for watching this video. Please like, share and subscribe this video to see more videos to come. Thank you.